In order to understand this research project, it's first important to define what high volume functional exercise is. It's a combination of two things, as we can see in labels 1A and 1B. First, it's functional training, which incorporates externally loaded resistance exercises with cardiovascular exercises as well. Additionally, it can be high volume, increased number of reps, weight, and a time component. In addition to that, the problem statement here is that in 2018, we saw that there was a cluster of exertional rhabdomyolysis associated with this exact style of exercise, where 11 of 44 ROTC cadets came down with exertional rhabdomyolysis. Now, other types of studies investigating the injury rates of this have shown relatively low risk of injury, as we can see in Table 3 at the bottom, and also that the benefits, specifically cardiovascular endurance, stamina, strength, flexibility, power, and balance, can be improved by functional resistance training. So the question then becomes, are we missing some of the risk factors associated with acute kidney injury? In order to investigate this question, we specifically looked at the workout, which is nicknamed MRF, which is named in honor of a Navy SEAL who completed this during his traditional training and who died in action. The workout consists of a 1 mile run, 100 pull-ups, 200 push-ups, 300 bodyweight squats, and a 1 mile run. Some people completing this while wearing a weighted vest. We investigated this in a total of 38 people who had no previous history of renal injury and no musculoskeletal injury as well. The measurements that we took were blood and urine based and occurred one day before, immediately surrounding the workout, and also 24 and 48 hours after the exercise. Now, it's important to also state that individuals could scale these workouts. They did not have to complete full pull-ups. They could do scaled pull-ups with their feet on the floor using rings, or do scaled push-ups with their knees on the ground as well. Altogether, 38 people completed the exercise and all blood draws following the workout, 10 women and 28 men. The average time for completion was around 65 minutes, and people completing this had an average training experience in this style of exercise of about 4 years. Now, the reason that we classified this as high volume and not necessarily a high intensity exercise is, as you can see, the percent heart rate reserve intensity was below the 80% threshold that is typically associated with high intensity exercise. And it makes sense given the duration of the exercise being over 1 hour. It would be challenging to think that an individual could maintain 80% of their max for longer than an hour in this type of setting. If we look at the outcome measurements, we see that the incidence of proteinuria at time point 3, which is immediately after exercise, was increased, shown by the red bar in figure 1. We also see that the number of people who reported or were measured to have hematuria after exercise increased at time point 3 as well. Now, these did return to resting values by time point 4 and 5 by 48 hours afterwards. The two other blood measurements that increased after exercise and remained elevated were both myoglobin and creatinine kinase. You can see at the immediate post time point, the myoglobin concentration was between 4 and 500 nanograms per milliliter, and also that our creatine kinase at the 48-hour time point was over 1,400 units per liter. Many of the variables selected for this study to evaluate whether the acute kidney injury was present before or after this workout showed resolution by the 48-hour time period. However, myoglobin remained elevated as stated on the previous slide, and also creatine kinase had peaked at the 48-hour and had not shown measurements going back down to resting at the end of the blood draw time course. 3 of the individuals in this study had CK values above 8,000 units per liter. 9 people had values that were 5 times their resting value. In addition, 1 individual showed CK values that were 115 times their resting value at about 9,000 units per liter. Now, we know that this is not necessarily the only marker for rhabdomyolysis. However, these can be consistent with some of the previous investigations. Overall, the important take home from this is that individuals participating in this type of exercise should make sure to scale the exercise when needed and also to abstain from other high intensity or high volume exercise for at least 48 hours following the completion of this workout.